What if you could reset your brain like a computer, rebooting into a clearer, more focused state? Would you do it? This isn't sci-fi tech talk, it's the reality of microdosing psilocybin. Microdosing psychedelic mushroom is rising as a tool for rewiring the brain. Patients describe feeling a reset, relieving the load of depression, addiction, and even helping gain a new balance of life. We're diving deep into rewiring the brain with microdosing psilocybin. Stick around until the end to learn if microdosing psilocybin is right for you. Microdosing psilocybin, a glimpse into brain transformation. Microdosing psychedelic mushrooms isn't about hallucinations or escaping reality. It's about fine-tuning your brain's function. Psilocybin in microdoses isn't just another drug. It's a key to a door long closed. What is microdosing? Microdosing involves consuming small amounts of psilocybin, typically ranging from about 0.1 to 0.5 grams. These doses are so small that they don't induce the intense perceptual changes often associated with psychedelic experiences. However, they are significant enough to initiate subtle yet meaningful brain functioning shifts. This practice is gaining popularity not just among those seeking mental health improvements, but also in creative and tech communities where individuals are looking for cognitive enhancements and creative boosts. The brain's reset button. The idea of microdosing as a brain reset is backed by scientific research. Studies, including those conducted by leading institutions like Imperial College London, have observed that microdosing psilocybin can lead to changes in brain activity, especially in areas involved with depression and mood regulation. These changes include the reduction of overactivity in the default mode network, DMN, a brain network thought to be linked to self-referential thoughts and reflection, which is common in depression. This reset doesn't mean escaping reality. Rather, it's like fine-tuning the brain's circuits for enhanced clarity and emotional regulation. It's fascinating to note that similar effects on brain activity have been observed with other treatments like electroconvulsive therapy, suggesting a potential universal reset mechanism for treating mental health conditions. Think microdosing is a modern discovery? Think again. For thousands of years, from the shamans of Siberia to the Aztecs of Mexico, mushrooms like psilocybin have been sacred tools for healing and enlightenment. Today, as we stand on the brink of a mental health revolution, these ancient remedies are re-emerging, offering an interesting journey back to the roots of natural healing. This is a call to rediscover the wisdom of our ancestors, a chance to unlock the mysteries of the mind with nature's key. Deep dive into rewiring the brain for depression relief. Imagine the brain as a landscape marked by peaks and valleys representing different thought patterns and connections. In depression, this landscape is often rigid, making it difficult for individuals to shift between thoughts and perspectives. Psilocybin therapy, however, appears to flatten this landscape. Post-treatment, the brain shows a more even terrain, indicating healthier flexibility and diversity in thought patterns. Clinical evidence and lasting impact. In trials involving nearly 60 participants, fMRI scans before and after microdosing psilocybin showed notable changes. These included reduced connectivity in brain areas overactive in depression, like the default mode, salience, and executive networks, and increased connections to previously underactive regions. Incredibly, participants reported less emotional avoidance and improved cognitive functioning. Psilocybin and similar psychedelics work on 5-HT2A receptors abundant in brain networks overactive in depression. The theory is that psilocybin temporarily disrupts these connections, allowing them to reform in new, healthier ways. This mechanism differs from that of conventional antidepressants, offering a fresh approach to treating depression without the long list of side effects from pharmaceuticals. These changes persisted for weeks, suggesting a long-lasting impact of psilocybin therapy. A new horizon in mental health. These studies not only reinforce the potential of psilocybin in treating depression, but also suggest its broader application in other psychiatric conditions marked by fixed patterns of thinking. Psilocybin's ability to make the brain more flexible and fluid opens new doors for mental health treatment, challenging the traditional approaches and offering hope for those seeking alternative therapies. But why does depression take hold of some minds and not others? The answer lies in the complexity of our brain's wiring and life experiences. Recent advances in neuroscience have debunked the oversimplified notion that depression is just a chemical imbalance. Instead, it's understood as a complex disorder influenced by an intricate network of genetic, environmental, and psychological factors. But what does this mean for addiction treatment? Psilocybin and addiction treatment. In the evolving landscape of addiction treatment, psilocybin, the active ingredient in psychedelic mushrooms, is emerging as a contender. Renowned institutions are conducting research that suggests psilocybin, when combined with therapy, shows promise in treating various substance abuse disorders, including alcohol, nicotine, and even harder drugs. The research insights. Promising results. Studies like those led by Dr. Michael Bogenschutz at New York University reveal that psilocybin-assisted therapy can lead to extensive behavioral changes in individuals struggling with alcohol abuse. Case studies. Take the experience of Amy Jamieson, who, through psilocybin therapy at the Johns Hopkins Center for Psychedelic and Consciousness Research, successfully quit smoking, a habit notoriously difficult to break. This reflects an 80% success rate in a small study group, significantly higher than the success rates of traditional anti-smoking drugs like Chantix. Addressing psychological needs. Addiction is often more than a chemical dependency. It's a coping mechanism for stress and emotional regulation. Psilocybin therapy appears to address these underlying psychological aspects, helping to reframe the mind's response to stress and addiction triggers. Mental flexibility. Psilocybin's role in activating certain serotonin receptors leads to increased mental flexibility and openness. This is key in breaking the rigid patterns of addiction, suggesting that psilocybin can provide a unique therapeutic experience, helping individuals develop new coping mechanisms and perspectives. Be optimistic, but also be cautious. Not a magic bullet. While the results are promising, psilocybin is not a universal solution for addiction. Responses to the treatment can vary greatly among individuals, and it's not yet clear how long the benefits last. Safety concerns. The use of psilocybin must be carefully managed. Experts emphasize that psilocybin should not be used outside controlled research settings or without medical supervision due to potential side effects and risks. While psilocybin therapy represents an exciting new direction in addiction treatment, it's important to approach it with balanced expectations. It's a promising tool, but not a cure-all, and should be considered part of a broader treatment strategy that includes traditional therapy and support. Why microdose? For many, the appeal of microdosing lies in its potential to alter deep-seated patterns of negative thinking and emotional dysregulation, often rooted in conditions like chronic depression and anxiety. It's seen as a beam of hope, particularly for those who haven't found relief through conventional treatments. Beyond its mental health applications, microdosing is also being explored for its potential in treating a range of conditions from anxiety to chronic pain. The idea is to use these small doses to recalibrate the brain's response to stimuli, offering a new therapeutic pathway where traditional medications may have failed. What's particularly fascinating is the anecdotal stories from users who describe improvements in empathy, relational skills, and a heightened sense of connectedness, painting a picture of psilocybin as a tool for holistic well-being. Microdosing psilocybin is about gently nudging the brain into a healthier state, not a drastic transformation, but a meaningful one. Microdosing psilocybin goes beyond merely altering our emotions. It's transforming our thought processes and how we interact with our inner selves. It invites us to create deeper connections with the world around us, awakening a sense of gratitude and wonder for the precious opportunity of life on this beautiful planet. This practice isn't just a personal experience, it's a gateway to a more compassionate, understanding, and connected humanity where every individual can contribute to a collective awakening and appreciation of the world we share. To learn more about the top benefits of microdosing, then watch this video. Share your thoughts and experiences in the comments below. Remember, sometimes the smallest shifts can lead to the greatest breakthroughs.